And there's a chapter 3 in here. And this chapter may get me unelected. But we calculated the cost of obesity. I can't tell you how many members here are terrified when I start to want to even have a conversation what we're seeing in the math. But we know diabetes, most just functioning type 2, diabetes is 33% of all healthcare spending. We know our brothers and sisters out there that have multiple comorbidities, that 5% of the population is over 50% of all of our healthcare spend. I've shown you chart after chart after chart here showing healthcare is the driver of our debt. And we got 5% of our brothers and sisters who are really sick, and the most common morbidity within that population is obesity. Of the 4,000 human diseases, and I have this one really well documented, 4,000 functioning, 2,000 are related to obesity. So 2 out of the 4,000. Are we willing to basically have a moment of honesty? I'm going to show you a couple charts here. We're in trouble. Have you seen the latest obesity statistics of our kids? Have you seen the numbers of how many Americans are dying? It's immoral that we're terrified to talk about this. And you're going to see in the report, because we spent a lot of time working on the math, and they wouldn't let us use some of the more optimistic math because it wasn't properly vetted. So we had to find peer-reviewed studies with lots of math and that could be recalculated and done. But we're looking at if we could stabilize the sickest in our obese population, both with productivity, because you get to come back into society and work, but also the healthcare costs associated, it's a few $1 trillion in the 10-year window. There is a moral path to save us from the crushing debt. Are we willing to adopt policy that basically says we love and care for people and we'd like them to live for a while? We'd like them to not be miserable all the time. But are we willing to discuss the Farm Bill?